Dear Dr. Akbari, hi, this is Natalia Maybe, and I'm Zayden Maybe's older sister. Zayden had a tumor in his brain that you removed on February 5th. Before that, on January 29th, you did a surgery to put in an external drain. On February 18th, you put in an internal drain. With all these surgeries, I was counting on you to keep my little brother safe, and you did. Throughout all of them, I was very worried and scared, but I was trusting that you would keep him safe. You kept my little brother safe and saved his life, and I cannot thank you enough. I don't know what else to say except to thank you again and tell you that you are like my superhero for saving him. Thank you.
Thank you, Dr. Boy, for getting my tumor right out of my head.
Oh, such sweet words. Dr. Akbari is with us. How does that make you feel?
That's a very humbling experience to hear that letter and hear Zayden's voice and everything. He has been a pleasure to take care of, and it's interesting to, so many times in this, we end up being so focused on the patient. And really, what drew me to pediatric neurosurgery was the fact that not only do we have to treat the patient, but we also have to remember that there are others involved too: parents, grandparents, siblings, friends, even. And so it really is treating the entire family and the entire picture at times. And hearing that letter from Natalia, thank you. It really reminds me why I decided to go into pediatric neurosurgery in the first place, and it really touches my heart to hear that.
And how do you help families cope with this type of diagnosis? And what about resources available to them?
Sure. Yeah. Once you get that diagnosis of a brain tumor, it can be very challenging, and there's a torrent of questions that come up. And we're always here for patients and their families. We have the neurosurgeons and the oncologists who are primarily there from a surgical and medical treatment perspective, but there's also a slew of other folks involved, such as the neuropsychologists who are there for helping with neurocognitive issues. Our physical medicine and rehabilitation doctors are fantastic and have worked really well with Zayden to get his strength back after surgery. Physical therapists, occupational therapists, care coordinators, and social workers all combine to really give patients and their families the care that they need and the comfort that they need in these trying times.